Everyone else who's joining us, thanks very much for joining us today. So welcome very much to our PRCA Health event on how to create compelling health and science stories. This was actually scheduled for a date back in May, when the world was still adjusting to getting back to some sort of sense of normality after 2 years of COVID-19. However, during that time, effective health and science communication was paramount, and even non-health stories were being told through that lens. However, as time and events have moved on, we still thought it was worth exploring what lessons were learned during the last 2 years and what we should really be paying attention to now in order to create health and science stories that really engage with our audiences. So today we're actually joined by a panel of speakers who've been providing their thoughts on this topic. It's great to have them all back and being able to welcome them back. And unfortunately, we couldn't do this in person this time. But we're really keen to kind of still manage to have a really great conversation, and we want you to get involved as well. If you can, please do share your questions with us in the chat. Feel free to obviously put on social media and include the hashtag PRCA Health and get involved in the conversation. So without further ado, I'm going to pass over to our speakers. We have David, Fiona and Rick. And David, maybe if I'll pass over to you first, maybe you can say who you are and kind of what you're doing.
Yeah, excited for this talk. It's going to be really, really fascinating. As Matt said, it's been like such an interesting couple of years, like sort of covering like the COVID pandemic, and then like sort of moving like sort of into the post-pandemic world. So I'm a freelance health and science journalist. So I work for a variety of publications, from the Telegraph to Wired to the New Scientist to the Guardian. So hopefully, like so over the next hour, I can sort of share some of those perspectives.
Great, thank you. And Fiona.
Yes, great. Thanks very much. Thanks for inviting me to take part. It's good to be here and interested to hear everyone's contributions. I'm Fiona Lethbridge from the Science Media Centre. We are an independent press office that was set up in the early 2000s after the kind of MMR and autism health scare era. We were brought about to put in touch with each other more often and more effectively, the scientific community and the UK national news media, to try and make sure that media coverage of science is as accurate and measured and evidence-based as possible. And we try and do that by helping journalists hear from expert scientists and helping experts and scientists have their voice on the big stories of the day.
Excellent, thank you. And then finally, Rick.
Hello, my name's Rick Evans, and I'm Social Strategy Director at a healthcare communications agency called 9010. And my job is advising clients on best practice in social media, and their clients all in the healthcare space, largely pharmaceutical industry, but also work with some smaller NGOs as well. And really advising on best practice for reaching healthcare professionals, patients, and the general public. I've been doing it really since social media was first a thing, so quite a long time now, and obviously it's changed a lot in those times and probably most rapidly in the past couple of years, so really looking forward to talking about that today.
Excellent, thank you very much. And I suppose, getting into a topic about compelling health and science stories, I suppose what we've really got to start off with is what is the main crux of a good health or science story? So David, when you are looking at writing something at the moment, what are the main elements that you look to pull together for your reporting?
Well, I think the big thing, the essence of any compelling health and science story, I mean, it has to be newsworthy. There has to be a very kind of strong news hook, and has to be a reason for, for writing this now. So whenever I write anything, I have to first pitch it to an editor and try and sell it myself to like a publication. And the first questions they're going to ask me is, why now? Like, how does this fit into the bigger picture? Why is this, unique compared to what other researchers or other companies like sort of doing? You've got to say, what are the stakes? And this is quite interesting because I get PR pitches all the time from like sort of a whole range of like, university like groups to biotechs to pharma companies, and often like the question which comes to mind is, what are the challenges? What has the struggle been? And also like, who are the interesting characters? How it can be like a really, really like some kind of interesting news story, but to make it into a wider feature, what is the narrative here? Who are the people who are going to tell this story? So I think all of those components come together, to make a really interesting story.
Right. And from that time that you've had, both in terms of thinking normal times, maybe pre-pandemic and kind of what throughout, what's been the general appetite for health and science stories from the editors that you work with?
Well, I mean, like, so over the past 2 years, obviously, I mean, health has been like sort of the #1 story, like very much in people's minds. And it's quite interesting, like right now, sort of, you know, kind of towards the end of 2022, like sort of COVID is starting to kind of fade from being like sort of huge news story, but like sort of it's been for like the last 2.5 years. And now we're kind of just, I think we're shifting just a little bit more back to what things were like in 2018 and 2019 before the pandemic. So, you know, like, so it's quite funny stories which, you know, they think are going to appeal most to their readers. So, you know, at the Telegraph, I'm back writing about statins and like Alzheimer's. You know, the Guardian, I'm back writing about like nutrition stories again and like exercise and fitness kind of things. So, you know, the publications are kind of slowly kind of reverting back to their own kind of little niches of, you know, like what they like to cover.
I think we've lost Matt, have we? Is it just me, or has Matt frozen as well for you?
No, for me as well.
Okay. I can continue on this topic if that's useful while we get Matt back. Yeah, I mean, I'm not a journalist, but I can say a bit about the kinds of stories that journalists approach us for. So one of the ways that we work at the Science Media Centre is that we've got this database of about 3,000 scientists and experts from across the UK at different institutions. And we're a kind of known piece of the science media puzzle. And therefore, journalists often will come to us. They know that we exist. They know we've got this database of willing scientists who are willing to get involved when their area of expertise hits the headlines. So journalists do often come and ask us for help. I think the appetite for science health stories is big in the UK. I think it always has been, really. I think we're lucky in the UK to have the specialist health and science reporters at each of the main UK outlets. So yeah, whether that's the Daily Mail, the Times, the Guardian, BBC News, Channel 4 News, all of these outlets have still got science and health specialist reporters, and that's great. And I think we're lucky to have that, because not all countries in the world have that. And I think we've got probably some of the most in the world. And that just means, of course, that their time is to cover science and health. And I think that I assume that reflects the level of interest there are among readers in science and health as well. So I think there is a big appetite in science. I think there always has been, and we're lucky to have the science specialists. And I think the same sorts of stories are, like David said, now that COVID is kind of lower down in the level of interest among journalists. We're still getting some inquiries on COVID, but we're also getting requests from journalists on all the usual topics that you're used to seeing in the news. So cancer, heart disease, dementia, mental health, depression, all of these kinds of stories, which have always been. Diet, nutrition is another big one, e-cigarettes, all of these stories which have always been kind of sexy to the media, I think still are. And it's maybe nice for us to be working on those kinds of topics again, and not just COVID. So David, we can see you again now. We still can't see Matt, unless that's just me.
Yes, I don't know what's happening with Matt, but I guess perhaps, like, so, you know, in his absence, I can maybe just sort of take over a little bit, like, so as the moderator. So we have a question, like, so for everyone, like, so here, which is, what kind of types of health stories do we see as the biggest coming on the horizon post pandemic? And I think, like, so Fiona, like, so you just mentioned, like, so kind of e-cigarettes and, like, so, you know, those kind of big stories which, like, the newspapers mainly like to cover. I totally agree with you. I think, you know, there's nutrition stories are always hugely popular with, like, so, you know, like the general audience. Insomnia, like headaches, I hear from my editors at the New Scientists, often areas like that always get huge amounts of hits when those stories are run. So those particular areas are going to still be very important. The NHS is going to be a massive story now, which, you know, like, so in the next kind of coming years of like the challenges of like funding and exploring more funding models, I think pretty much all the major kind of like news organizations are going to shift towards that. I think one of the legacies of COVID now is that we have maybe an increased focus on global health, and there's going to be like some increased monitoring, not just of, you know, in the past there's been massive focuses on individual diseases like Ebola and like Zika and things like that, but I think now, like, so through COVID, like, so journalists are much more aware of, like, so the need to keep monitoring for those kinds of stories. So I think that is going to be a very much like, so, you know, we've seen it with monkeypox, like, so earlier this year, like the amount of coverage that got. I think those infectious diseases stories are still going to be very, very present. And of course, like long COVID, that is going to be a story, and the economic impact of that, which will run and run, I feel, in the next years to come.
I can say actually from my perspective, which is a bit different to everybody else's, because my background, and I guess my job is working mainly with pharmaceutical clients and advising them on their social media. And actually, like, a few of those big companies in the past few years have become household names. They weren't before. So Pfizer would be a great example, obviously associated with Viagra for many years, although probably wouldn't have been known by a lot of the public, and certainly not for anything else. Suddenly everybody knew who they were, and they were facing a very different challenge, that they're suddenly a victim of lots of kind of trolling online, and lots of misinformation about their products, and also harder for them, and also I think for other pharma companies who've been a bit frightened in the wake of that, to be able to talk about other health areas. And I think there was a lot of fear at the beginning about whether it was appropriate to be talking about other topics than COVID. And obviously many of those companies weren't making products in that space, or if they were, you know, what was the balance of those stories? So I think there was a lot of fear, and I think that's probably settling down a little bit now. But that's the sort of industry perspective I've seen. And I think now some of these companies are facing a different kind of image challenge, and one that perhaps in some cases they're looking to redefine.
Yeah, that's a really important chance, Rick. And I don't know if any of you noticed, actually, I was a victim of one of the major drawbacks of being virtual with tech issues. But thank you very much for carrying on there. But I wanted to just pick up on that point, actually, where you're saying about pharma companies and other healthcare companies feeling they had to talk about COVID, and if they didn't really have much to talk about. Do you feel that's changed now? And if so, do you feel that they're actually taking hold of this opportunity, that, you know, they've got that raised visibility, but yet maybe some of them are still being too cautious in terms of what they're communicating? So it'd be great to get your opinion on that, and then maybe go to Fiona.
Yeah, I mean, I think that a lot of the companies got a lot better at using different virtual channels. So, I mean, Pfizer, again, as an example, their antigen podcast was really popular, and it's really good. They've created really good content for sort of thinking beyond that, that professional audience that they've always been very good at reaching. And I think that's true for the industry as a whole, have started to think more about creating content for patients and the general public, which is scientific, and has that little bit more detail for people who are like really interested in the science and how things are made. I think there's been a real push as well in really kind of reassuring the public about the process that goes into developing a drug. So, you know, many stages are required. And I think there was a lot of fear around the vaccines about how that process had been accelerated, and people thinking that because it had happened really quickly, that therefore it wasn't valid or it wasn't viable. So I think there've been a lot of conversations about educating people more about that process, and also and I think this is something that the industry are probably a bit afraid of, is failure. So, you know, many drugs will fail like quite early on in the process, and many pharma companies historically never really want to talk about this too much publicly. But actually, I think there's a big sort of body of evidence that suggests that sort of standing up, owning that failure, it really contributes to the scientific debate, and actually probably ultimately reassures the public that the process is valid. I'm sure Fiona's got some like really interesting perspectives on that as well.
Yeah, thanks. No, it's really fascinating, and it's interesting. I don't know what the answer to this question is, but I keep wondering, and hopefully someone will kind of produce the data at some point, but I do keep wondering whether the perception out there among the public of, you know, big pharma is different now, has been changed by the pandemic. I think, like Rick said, a lot of these companies are now household names, which hadn't been before. And also the pandemic kind of illustrated the role that pharma has in science, and what it can deliver. And obviously thank God that we have the COVID vaccines that we have now. So I don't know what the answer is to the question about whether the public at large feels differently now about big pharma than it did before, but I'd be really interested to see some data on that, and I wouldn't be surprised if it has changed. In terms of taking opportunities to speak about all these issues, then I think there are plenty of opportunities out there, and I think it's worth, there's no time like the present, and I think the time is now to take hold of these opportunities because of the kind of standing and voice that a lot of these pharma companies have found during COVID. And there is, as we were discussing earlier, there is still massive appetite among journalists, which I presume is reflected in their readers, to hear about all these kind of health topics which these pharma companies are working on. So a few kind of issues that I would say, just from our perspective of working with companies at the Science Media Centre, and also what kind of things journalists are asking. So I think one thing that could be kind of an opportunity that could be taken is just to encourage scientists and experts in pharma companies to speak, to answer the phone to journalists, to answer questions, to do interviews, to be visible, to be accessible to the media, who a lot of the time want to find out the answers to quite scientific questions. So let them speak. I would say let experts speak, encourage them to speak. I'm sure, I'm not naive. I don't want to be naive about these things. I know there's all sorts of levels of sign off and commercial sensitivities and reputation and all that kind of thing. But I also think that if scientists are encouraged and empowered to speak, then they come across as human beings as well. They come across as real people, not politicians. And I think one thing that I felt during the pandemic is how well people and journalists tended to respond to people who sounded like scientists who sounded like scientists. They were sciencey. They were talking about things like uncertainties. They weren't just talking in kind of sexy sound bites. They didn't come across as polished and briefed to within an inch of their life. And I think people see through that. I think we all know that. We know it when we see on the TV politicians or whatever, and you think that doesn't sound real to me. That doesn't sound like someone who's talking about evidence or science or uncertainty. This sounds like a person who's been told what to say and has their kind of sexy soundbite written down. So I think, encouraging and encouraging scientists to speak to the media and to answer their questions is a massive opportunity that's out there now. And yeah, don't sound like a politician. Sound like a scientist. If you're a scientist, sound like a scientist. That's why you became a scientist, presumably, is because you're interested and passionate about evidence and data and uncertainty. So talk about all the stuff, like Rick said, talk about things that went wrong, talk about failures, and we all need to know this stuff. And one thing about the pandemic, perhaps, was that the public sort of saw science happen in real time in a way, and that did include things that didn't work. We found out through experiments and through science what didn't work. So perhaps again now is a time that this is all fresh in the public's mind, how important things like clinical trials are, how important things like uncertainty and testing hypotheses and finding out what happens. So I think, yeah, to talk about those things. And we found at the SMC, prior to COVID, we always had some difficulty kind of accessing expertise within pharma companies for lots of reasons, I'm sure, but we were a bit sad about that because, we know that a lot of the best experts are in pharma. And for example, we would know some top scientists who worked for university, and we heard from them every week, and then they got a job in a pharma company and they sort of disappeared from our we weren't able to access them, and that meant that the journalists and the public weren't able to access them. So that felt a great shame because their expertise hadn't disappeared, just how their academic freedom, I suppose, had. So we had been sad about that before the pandemic. During the pandemic, we had access much more to lots of scientists within pharma companies. We did briefings with AstraZeneca, Moderna, Pfizer, GSK, MSD, Valneva. And this was great for us because, yeah, here we were putting on panels of scientists, some of whom or all of whom were who were at pharma companies, and the journalists came along. They wanted to hear from them. They wanted to ask their questions. Some of them would have been difficult questions, of course, and that's the role of the journalist. But I think it was a great look for pharma companies to put their scientists up, to have that transparency, to have them open to questioning. And so I think there's a lot to be said for being accessible, answering questions, and being sciencey and talking like a scientist.
That's great. And there's so much in that answer that I feel that we can probably pull apart as well. But one thing that would be really interesting there is where you're saying talk like a scientist. And obviously during the pandemic, we were able to, we all got very used to hearing about R rates and learning about virology. But epidemiology, did many of us, do you think that sort of level of knowledge and engagement is still there? Do you feel that essentially that journalists are still coming to you with that sort of high level questions, and same to you, David? I mean, do you find that the audiences still want to hear that, or are they now going back to as it was before the pandemic, and they just want the sort of the nutrition and the sort of the general health and fitness stories? What sort of questions are you both getting now?
Fiona, do you want to take that one first?
Okay. Yep. No, I would say that the science journalists do currently and always have had very sciencey questions. They want to hear about, I mean, we love it. It's a bit geeky, but in our briefings, the journalists will often sit there and ask about the confidence intervals, or ask about the p-value, ask about the statistical significance. And I think this maybe comes back to what I was talking about earlier, which is how lucky we are in the UK to have the science and health specialists who are used to covering science. They know what statistical significance means. They understand things like uncertainty. Of course, like you say, some of them will sometimes want to kind of want to ask a more policy relevant question, or they might want to take a line on, or their publication might want to take a line on something. But in our experience, the journalists often have very technical questions, scientific questions about the data. And that's, I think, when people sound like scientists, is when they can answer those questions. So they don't just come out with a soundbitey answer, which doesn't really say much or doesn't go into detail. They can bring up the graphs, they hold up a picture of the graph, they show the confidence interval, they talk about the stats. So yeah, I think whether it's on nutrition, or whether it's on COVID, or e-cigarettes, or statins, or antidepressants, whatever it is, the journalists do often have technical data, detail-y questions. How much of that makes it into their articles, of course, varies, but I think a lot of them want to have that level of confidence of understanding the study, understanding what the data do and don't say, to then go to their editors and say, this is what the story is, and should we put it on the front page, or where should we put it? So that's my experience. But yeah, David, I don't know if you have any.
Yeah, I think one of the interesting things actually about 2020 is that, as you said, like Matt, there was kind of an appetite from the audience of things which, I definitely would not have been able to get like past editors before. I wouldn't have been able to get pieces like commissioned on the minutiae of antibody testing, or other forms of diagnostic testing, or viral transmission, which was suddenly of interest to so many people. I remember, I think 2018, I tried to pitch a story on monoclonal antibodies, and that was sort of deemed a little bit too technical for a general audience. And I read a piece of National Geographic on that in February 2021, which I don't think would have happened before. But I think a lot of these pieces did very well and got massive amounts of hits. And I think what it actually shows is that, particularly when there's a very, very kind of big health story, or something which everyone kind of cares about to some extent, there is an appetite and a demand and an interest from the general public into the more technical aspects of the story. And I think it's something which very much pharma companies and biotech companies can bear in mind going forwards. Rick talked about before, the fact that pharma companies are sort of coming out of their shell a little bit, and kind of starting to sort of show a little bit more about the inner workings of their processes. And I think that helps the general public to kind of to build confidence. We've all talked about the anti-vax conspiracy theories in the last couple of years, but for many years there's also been conspiracy theories about cancer. There's long been the kind of a perception that perhaps the pharma companies have cracked the cancer myth long ago, and all trying to keep it to themselves, some kind of Machiavellian means. But I think a lot of these kind of conspiracies can be addressed by the pharma companies being look, these are all the failures we've had. These are why they've happened. These are the scientific reasons for why clinical trials fail, for why so many of these drugs like don't make it forward, for why like cancer cell evolution is such a continuing problem, and why, you know, immunotherapies might work for some patients, but for a lot of patients, they still don't work. And these are things that are actually explaining more and going more into the technical aspects. I think, you know, it helps like sort of, you know, avert some of the conspiracy theories, but also the interest like a huge number of people, and perhaps more than people previously realized, and we've seen that very much from the pandemic.
I mean, when you talk about that sort of misinformation piece, I mean, obviously you say it came a lot, or you do get a lot around anti-vax during the pandemic. I mean, a lot of that push has been through the advent of social media. And I don't know, Rick, if you've got any thoughts about this kind of, how has the role of social media kind of affected this? But now obviously that everyone is accessing news and communication via digital platforms on many different social media platforms and online platforms. Kind of how do you manage to reach each audience and kind of do it in a way that's kind of engaging and fit for that channel?
Well, it's a very, very difficult point, partly because the social channels are largely driven by algorithms. And if you're the kind of person who engages a lot with that sort of anti-vax conspiracy theory content, chances are that the kind of content that those social channels then serve to you is similar content, the type of content that's been accessed by similar people. So most of us, when we use those channels, live in something of an echo chamber where we're just hearing our own views and our own perspectives ricocheting around, which it means it can be really hard for people to kind of hear a different perspective. And you can understand how young people in particular can become radicalized by different opinions. So this isn't just in the health space, but in many other political dimensions as well, but lots of them tied together. Now, there are big moves and pressures from different countries, from different organizations on the actual social channels to get better about this. It's a slow process. The channels basically make their money from advertisers. The algorithms are what make the channels popular as well, because people get content that they're interested in. So there's a battle going on really to improve access to good information. And it is really a slow battle. And I don't really have a clear answer for how it's going to get better, other than I do think that the channels are starting to take it a little bit more seriously, particularly at a more local level. I think that the challenge is that they are big, huge kind of global companies, and trying to sort out what is a huge problem is very, very difficult. And yeah, and I think it's evolving every day. You know, there's new channels coming out. You've got new channels like TikTok, which is actually really interesting in health. Like there's loads of like young doctors, loads of scientists on TikTok who are really using it to share health messaging. We saw that a lot in the pandemic, lots of people sharing positive information to try and negate some of the negative information that's on there. But again, if you're not really engaging with that content, the chances are that you're not going to see the more positive, the more truthful stuff. So it's a challenge.
It is. And you're raising an interesting point there to the rise of influencers and being able to communicate messages now. I mean, do you see many companies in this space doing it well at the moment?
Well, I think that all companies now are really starting to focus on what they call influencers, but it's really about messengers, and it's about working with the right messengers to get the right message across. So obviously using the right platform is important. We know that TikTok obviously has a much younger audience currently than other platforms, and that's probably at the age as well where people have a little bit less of the critical faculties to be able to recognize things that are reliable or not reliable. So if anything, we should be sort of focusing our efforts a little bit more on those channels. And I don't think that the industry they're still, or the pharma industry anyway, is a bit scared of TikTok because it's a new channel. So they're not really working so well in that. But we have seen companies working with both internal and external influencers. So actually senior leaders, scientists within the organizations. I keep mentioning Pfizer, but the Antigen podcast was one which I brought up before. And I think that that's a really nice example because they actually worked with a lot of their internal influencers to produce that. There's some external voices on there as well. But I think that that's a great example of a company realizing that they've got loads of influential experts in the organization who are really qualified to speak. And, you know, they're talking in a sciencey way, as Fiona said, which is really important.
Great. We've got a couple of questions in the chat, so I'll just bring these up first. So the first one is, what top tips do you have for comms professionals who are looking for the best package story and are trying to get cut through? So David, maybe I'll come to you for that one first.
Yeah, well, I think like so the main tip is it really, it has to have like some, to get through and to get picked up by like a national newspaper, it has to be a good story at the end of the day. Like it has to be relevant. It has to be like so kind of tied into like so something which is kind of newsworthy or like so, kind of general interest. I think one of the biggest mistakes, which I think a lot of comms professionals make, is that they kind of pitch too many non-stories to journalists. And then when we do actually have something kind of relevant, they sort of lose that trust with the journalists. They've damaged the relationship. And so the journalist isn't really like listening to them anymore. So I think in some ways, one of the best approaches comms professionals can take is a bit more like a selective approach. I think different journalists will be relevant, like so for different stories. A lot of people in the comms industry, they will just, send out pitches to 100 likes of health journalists, and that story will maybe be possibly relevant, like so for 10 of them. And I think that a lot of in times the way forward for comms is like a little bit more of a selective approach, pitching the right stories to the right journalists, and then having that targeted approach tends to, build more trust for the long term. I mean, just as a classic example of this, like recently I saw like the editor of a British medical journal who I work with like so quite regularly is getting like sort of pitched like Christmas gift guides. Now, this is a guy who does in-depth stories on like Ebola or like so kind of very science heavy. He's not interested in Christmas gift guides. So I think that targeted approach, working kind of closely to try and like sort of build a relationship with a journalist, almost a little bit more like some kind of old school PR, like so comms, is very much like sort of way to go in like the modern media industry.
Okay, thank you. And I suppose a follow-on bit for that is kind of, if people are looking at this, how do you decide if something is a health story or a science story? If you've got a story that you want to approach one journalist with, how do you kind of make a decision on who's more likely to write it?
Well, also as well, I mean, it does become like so quite segmented, like so there's within health, there's so many different types of health. There's global health stories, there's nutrition stories, there's health policy stories, and they all tend to be like so covered by very different people. So I think before like so actually sending out the pitch, doing like a little bit of research into like the individual journalists, looking to their back catalogue of articles, is there a little bit of a pattern in the things they tend to cover? In some ways, staff writers, and editors are easier people to pitch to than freelancers, because I mean, I can speak from myself. I tend to kind of like jump from topic to topic, while staff writers will have more of like a dedicated beat. That's something which I really want to follow like sort of in depth, and they're covering the same thing like the whole time. They're possibly going to be more interested in building a long-term like relationship with the PR, particularly if they can regularly feed on like so that source of stories. Also, I think what a lot of comms professionals like so underestimate is the importance of trying to like build a relationship with an editor. Building a relationship with journalists is one thing, but editors are the people who have real power. They actually commission the stories. So they are the people that, almost the big people you want to kind of try and get those like long-term lasting relationships with. But in terms of journalists, I think, just doing the research like so beforehand and getting an idea of a little bit of whether that is the right story for the right journalist, that I think that goes a long way.
It definitely sounds like you are talking yourself out of being pitched to by everyone on this call.
I'm very open to pitches, but I mean, I think it's just, every journalist has this, like, so I literally receive about 100 pitches a day, and at least 80 to 90% of them are just like not relevant, like so the kind of things which I cover at all. So I think, just a more targeted strategy, and there's like a handful of comms people or PRs who have kind of like built relationships with maybe over the last kind of 5 or 6 years, and I know that when they actually come to me, it's something which I can like take the time like so to to consider.
Definitely. And before I go into the next question from the audience, actually, I just want to kind of get a good understanding with Fiona. How do you work with companies and scientists to help answer these stories for journalists? Like, I take it it's not just obviously the press office who go out and do this. You're obviously working with companies and experts to do this as well.
Yeah, so our three main kind of groups of people we work with are scientists, press officers, and journalists. And yeah, we've got this database of expert scientists and also press teams. So we at the Science Media Centre, we're not kind of affiliated with any one organisation, and we like to keep abreast of the research that's going on and where the experts are. But we also rely on press teams, press officers who know their experts inside out and know their research and know what's coming up. So we work both directly with the scientists if they know us already, or if we approach them, we often have really good relationship with them directly, but also via the press officers. And we also would always, if something has come direct from a scientist, we would also copy in and make sure they were in the loop, the press team as well. So things like press briefings. So we do press conferences all the time, and they can come about through either of those channels, really. So if a scientist knows us already, they might get in touch and say, we've got a paper coming out next week in The Lancet. It's about this topic. Can we do a press briefing on it? Or their press team might be the ones to get in touch with us about that. So yeah, it's really both directly with the scientists and with the press teams. Probably with pharma companies, it's more often with the press team than with the scientists themselves, for various reasons, which everyone will be clear of. But we like that. We like people pitching suggestions of briefings to us, and we always like to hear what's going on. And so yeah, we definitely want to have good relationships with press teams. And then just a couple of points I was going to add to what David said. I mean, I completely agree about, in terms of the top tips, kind of knowing your audience, knowing which journalists to go to, not going to a journalist with something that's completely out of their beat or completely inappropriate to what they would, the kinds of stories they would normally cover. And then just to say a bit more about, obviously everything David said is absolutely correct about what makes a story, and he's the journalist, so he knows, but also just to kind of put a shout out for accuracy and responsibility of doing PR. So I think it's responsibility on all of us, press officers as well, to try and make sure that things are covered responsibly and in a measured way. Obviously, having kind of patients in the public at the forefront of our minds when we're doing things like writing press releases or pitching a story to a journalist, because I think the last thing any of us wants is to kind of raise hope prematurely, for example. So I think having that accuracy and responsibility, and not kind of trying to make a story something it's not, to make it fit in with what the categories David mentioned of something that is a story. So the stories will come along. You will have stories that are big, so you don't have to try and make them big every time by kind of molding them into something that they're not, which then would make it kind of inaccurate and not representative of the situation. And then, yeah, just journalists, as I was saying earlier, the science journalists love to hear about data and numbers and evidence. So they want to have things like detail and numbers in anything that's suggested to them. So if it's very vague, then you might find yourself having lots of questions about, yeah, but where's the data? What are the numbers? Show us the graphs, show us the data. So be ready with that. And then I would also say, again, David's talked about pitching, and that's great. I think if you've got maybe a more niche thing or something that's specific to a certain audience. I mean, I think what we saw during the pandemic, and I think applies to a lot of the stories that we work on at the SMC, is that many of these science and health stories are relevant to everyone out there. And so I just wanted to say, don't throw the baby out with the bathwater in terms of, if this is a story that's relevant to the public, and of course, during the pandemic, things like public understanding of science, public behavior had an impact itself on the course of the pandemic. So if a story is important enough that everyone needs to hear about it, then maybe that is one for a wide press release to all the journalists, because it's important that it reaches the Sun and the Mail, who have the biggest audiences out there. And then I would also just say, in terms of top tips, we often say at the Science Media Centre, science in the headlines is an opportunity as well as a risk. So I think a lot of places are kind of, oh God, a journalist is asking a question, or oh my God, our area of research is in the news. But actually, yes, it is, and we understand why that can be a concern. But that's the very time that the public are actually interested in hearing about this. And like Matt, you were saying earlier, who would have thought that the R number or you know, false positives and false negatives, or you know, viral transmission would become things that that everyone in the public talked about over the breakfast table or whatever. So that was a kind of a funny thing that happened during COVID, but that represents an opportunity. That here's the very time that the public want to hear about this evidence, want to hear about what the science says, and want to know more about this topic. So these are opportunities, as well as kind of slightly scary experiences for some scientists or for some press teams or for some organizations. Actually take that opportunity to, you know, if you're thinking on the other hand, how can we pitch this thing? How can we get this thing into the news? Well, don't forget that these things are often in the news, and use the opportunities of when there's a breaking news story, for example, when there's a big development in something. So I'd say kind of make every relevant story your business as well, and don't only sit up and say something when it's about your product or your drug. When something's in the news about clinical trials or vaccine development or a scary side effect or something like that, everyone needs to get involved there, so that the public gets to hear from a range of experts in the area. And then I think if you're more visible and you're more out there, then journalists are more likely to maybe think of you and come to you next time they've got a relevant story.
Yeah, Fiona makes like a very good point there, actually, because typically when any kind of big health story like breaks in the news, be it like a study or, you know, like something like relating to public health, journalists are needing to write these kind of very fast reaction pieces and get quotes like very quickly. I mean, and I rely massively to do my job on like Fiona and the rest of the Science Media Centre team, because, you know, often I have like a few hours and I need to try and find like an expert there. But this in itself is a massive opportunity for comms professionals, as Fiona has just said. You know, the big thing which journalists often need is like people who are willing to like provide like opinion, to provide quotes at short notice. So, you know, like it like as you know, a big story has like been released on like cancer or clinical trials, then, you know, don't be afraid to reach out to journalists and be like, we have someone who's willing to like comment on this today, or email over like kind of quotes, that kind of thing. Like journalists often just really need like a few sound bites from someone like to kind of make their piece. So that is a massive opportunity for press offices, comms teams, like up and down, like to you know, to get your people into an important story.
That's great, thank you. And Vic, I don't know if you've got any bits you want to add on. If not, I'll go on to the next question.
Oh no, I think they've answered it so well.
Wonderful, yeah. No, and this way actually goes back. It's actually linked into this perfectly, actually, because you're both talking about, you know, seeing the big picture and being proactive, but also kind of knowing your audiences and being very specific in terms of the channel you kind of or the people that you're targeting. And Matt in the audience has asked as well, do you think communications professionals need to segment their approach more? With vaccines, government had some success placing content and setting up conversations with audiences on platforms like Reddit, Mumsnet, and TikTok. And yeah, I mean, this is obviously the massive challenge for government had anyway, is that they had such a diverse range of people they had to reach, both online and offline. It's how you do that in an authentic way. So do you think that's something that, you know, maybe we should learn more from, is kind of actually knowing the audiences and picking the right channels, or rather than necessarily doing a one size fits all?
Yeah, I mean, to be honest, I actually think that the one size fits all is the absolutely the worst thing. I understand it's done quite a lot to save time, to save money, but frequently exactly the same piece of content is distributed across so many different channels, and channels it's not right for. So I think it's thinking about several things. It's thinking about the audiences who use different channels and making sure that the content you produce is tonally right for that channel based on the type of people who use it. It's also thinking about the type of content that performs well on the channel. So if we're thinking about something like TikTok, it's quite fun. Everything needs to have that. It doesn't need to be totally comedic, but it needs to have that sense of pace to it. It needs to fit in with the other type of content that you might find on the channel. If something's on Twitter, it needs to be very news driven. It needs to be very topical. Things that are a bit more evergreen that could go out on any day don't tend to perform that well on Twitter. So it's finding that sort of hook for that channel. On Facebook, for example, it's very friends and family focused. So you can be a little bit more emotional on that. And in fact, if you're a bit cold and if you're a bit distant, which you can get away with on Twitter, if you need to be, you know, get a message across, you can't can't do that on Facebook because it's much more touchy-feely. So it's thinking about those nature, and then it goes back to what we've been discussing before, which is about the right messenger. So making sure that you've got the right person, and the people who are credible, the influencers, again, can be different on different channels as well. So it's making sure that that research is done as well.
Great. And, you know, from this, I know obviously you've mentioned a few organizations before about this, but are there any organizations that you have noticed that you think are particularly good at communicating health and science information?
You know what, I actually think that the World Health Organization did a really good job through the pandemic. I think people deferred to them a lot, and I think they realized, like a lot of my clients in the pharma industry as well, were trying to copy everybody with their sort of hand washing tips. And then after a while, they realized that they'd refer to the big sort of health bodies. And I think it's thinking about who's the appropriate messenger as well. So who is going to be the trusted voice. And I think one of the struggles we had with clients when they thought, oh no, we've got to be the people who've got to get out there, we've got to say something. When I think what we were trying to encourage them to do was actually think about what your key messages are, which were generally about their supply chains, about people who weren't necessarily affected by COVID, but would be worried that their diabetes medication wasn't going to get through because of supply chain issues. Like, that was the story that was right for them to tell. But what we were really trying to encourage them to do was to find the big health bodies and the big health organizations who would be more trusted and were the right people to give those messages. So I think it's obviously a very crowded field, but I think that they actually did quite a good job. I think that whilst it was very criticized in many different ways, I think the sort of simple sloganing that we ended up with from the UK government, and it was mocked, but I think it did stick. And I think having those kind of the sort of three point messages that they went for ultimately was quite effective, because everybody remembered them. And even if they were joking about them, I think everyone, most people, would have been able to tell you what they were. And I think that was actually quite an impressive feat.
Yeah, they always do say that if you are lampooned, it means that you've kind of got through to the public, doesn't it?
Yeah, I'm not sure how the others on the panel would feel about those, but and like I say, that they were mocked, but I do think that they were memorable. And I think going for a very simple messaging approach like that probably was the effective way to go.
Right, thank you. David or Fiona, have you got any thoughts about that as well? Who's really caught your eye, either through the pandemic or even now? Who do you feel is particularly good at communicators around health and science?
Well, I think one thing which you found, which is quite interesting as a result of the pandemic, is, the rise of the academic influencer on Twitter. That's a huge trend we've seen the last kind of 2 years. Previously obscure epidemiologists or public health professors who now have 200, 300,000 followers on Twitter, and they are influencers in their own right. And that is a massive achievement. And it has actually created a little bit of a silo in terms of health communication, because before typically you would have been able to reach out to these figures and get interviews with them quite easily for stories. But now they're a bit we don't actually need the media. We are platforms in our own individual right. And they basically, I found if you try and get an interview with them, they will basically be you can just see my Guardian opinion piece or see my Twitter thread, which I've already kind of posted. And I think that is quite an interesting approach. And, I think that's going to be quite an interesting thing over the next few years.
Yeah, I would say maybe a bit differently, but I suppose it depends on who you're thinking about and what their audiences is and what you wanted to try and achieve anyway. But from our perspective at the Science Media Centre, so we do the sciencey bit, then I think there was loads of really good scientists, whether they were university academics or whatever, who were so effective because, for many reasons, but one of which being they stayed in their lane of expertise. And by that, I mean, they didn't become a commentator who commented on everything. They weren't just an armchair epidemiologist. All of us were armchair epidemiologists during the COVID. We all had our opinions on what was good and what was bad, but that's not what we want from science. We want scientists to do something more, something extra. And that is when their expertise, this was their time to shine, right? This was their area of expertise was in the media. So the scientists who really stuck to their expertise and stayed in their lane made every story their business, as I was saying earlier, but when it was their expertise, they weren't just a campaigner. They didn't sound like somebody with an ideological position. I think there were plenty of those, actually, to be fair. During COVID, we did see people, including some scientists, becoming campaigners on an issue, approaching something with their ideological position. And I think you risk losing the trust of the public there. We all know how massively trusted scientists are compared to governments, media, I'm afraid to say. But I think one of the reasons of that, for that trust, and it's trust that has to be earned, it cannot be assumed, is by staying in your lane of expertise, sounding like a scientist, talking about uncertainties, being really sciencey, not just being a commentator or a person with an opinion, but talking from your expertise and talking about evidence. So I would say, as a scientist, if what you're talking about is scientists and evidence, don't do messaging. That, you know, that's for governments. Governments do messaging. Science is not messages. Science is data, and it's evidence. So remember that, and sound like you're talking about evidence. And then just getting, I mean, I don't have any expertise on social media or influencers. We don't do most of our stuff by social media. We do most of our work via the mainstream media for good reasons. So I would say, I mean, I know David said that some kind of academic influencers are saying, you know, we don't need the media anymore. I would argue against that. I think we do still. I would say, you know, ignore the mass media at your peril. It is still where most people get most of their information from about science. Of course, that might be accessed via a different route, and, you know, people might be on Twitter and they click a link and that takes you back to the Mail Online website or the BBC News website. So I think we often think everyone gets their information from social media without, I don't think we yet know exactly what that means. Does that mean they're only listening to their auntie's dog's friend who said the thing in a pub? Or actually, does it mean they're seeing journalism from either journalists who themselves are posting or from outlets who are tweeting? So I think, again, I think we can't yet assume that people are not accessing news, especially, as I was saying earlier, the people who aren't already seeking out science, who will have a different level of understanding anyway. So I think the mass media has massive reach. The public still gets a lot of their information via the mass media, even if it's not that they're buying a newspaper every day. So I think, yeah, don't ignore the mass media, and remember the reach that they have, and still see the mass media as an important outlet, of course, among all these other ones as well.
Right. And you know, we've talked a lot here about science and media and those key spokespeople for these campaigns. What is the role of patient associations, patients, and sort of people with lived experience? How do you feel that we should be using them better? Sorry, David, that's to you.
To me. Oh, sorry. Yeah, I think those are hugely important. I mean, as we've seen, like, so, you know, kind of particularly with long COVID, it has been patients who have actually kind of driven lots of our understanding of the disease over the last kind of 2.5 years. And in many ways, it kind of like contributed to, you know, the rise of a huge amount of like research and like media attention back towards chronic fatigue syndrome, or ME/CFS, which had kind of been neglected for like a long time, even though it affected a huge number of people. So I think that those lessons have kind of just shown us that we need to listen to patient organizations, try work more to actually incorporate them into stories, because I think sometimes we are kind of sometimes in the danger of just relying entirely on, you know, kind of scientists and medical professionals, but ultimately the patients, they do have a degree of expertise as well, because they're the people with the conditions, they understand about it. And that is kind of where often really good health stories are found, you know, some patient populations who've kind of been ignored or overlooked for whatever reason. And then that actually goes on later on to kind of change science itself. So I do think, yeah, the last kind of 2.5 years have shown journalists very much that, you know, we need to actually listen, pay attention to the voices of patients and their advocates, perhaps as much as we pay attention to scientists.
Right. And Rick, do you have any thoughts on that? How do we kind of use the patient voice better in terms of our communications?
Well, I mean, you know, working in a social media area, I would say that any image or any post that features a a real person in it. And I'm not talking about a stock image, but a real person, whether that's their story, whether it's their photograph, whether it's their video, always performs much better than anything that's just a stat or that's dry. So, you know, giving real context to stuff, it's perhaps not a surprise, but it makes a massive difference in terms of engagement. So in terms of the content that we develop with our clients, it's always really important to get as many different voices as possible, but particularly that patient voice, which can sometimes sort of feel like a little bit removed from the situation. I think where we face challenges, though, are perhaps in areas where there isn't a lot of light at the end of the tunnel, so there aren't many kind of treatment options. Or if we're talking about looming health problems, so things like antimicrobial resistance, for example, where, you know, the sort of scenario that is potentially approaching is very bleak, and there aren't many positive stories around it, or, you know, you kind of want to have more stories to be able to tell, or more kind of positive plans in place, and it's quite difficult to get those conversations across. That's perhaps where it becomes a little bit more challenging, and we always want to put some kind of positive spin on a story. So I think from our clients' perspective, that can sometimes be the biggest challenge.
That's great, and that's actually why I wanted to pick up with both David and Fiona on is, you know, now looking at, you know, now we are beyond COVID, what are the kind of stories that you're both now kind of being approached with and that you're seeing as major trends for now?
Yeah, do you want to take that?
Yeah, sure. Yeah, we touched on this a bit, Matt, when you disappeared, when you had tech issues. So I think for us, we are still getting some questions about COVID. It hasn't gone away, obviously, and we're approaching winter. So we're also being asked about the flu and other respiratory viruses and what's going to happen there. But then in a way, it feels to me like it's the same kinds of stories that are of interest now that always were. So whether that's diet and nutrition, cancer, Alzheimer's, heart disease, mental health, climate change, if we're leaving, because we do environment as well as science and health, so climate change is massive as well. So all these topics, which have always been kind of sexy media topics, I think still are, and I think they are increasingly there's room for them in the media as well. From informal conversations with the SMC, we're kind of feeling our way a bit at the moment, I think, in terms of I'm finding it difficult sometimes to judge where the bar is for a story on a different topic, whether that's COVID or non-COVID. You know, is this going to be a story? Are the journalists going to cover this one, or is it not big enough? And I think maybe that's the case in some newsrooms as well, in terms of what's big enough to be a science story. And we also heard in informal chats with journalists that for some of them, they were saying towards the end of the biggest worst bit of COVID, some of them were saying, oh, my editor, we don't want any more infectious diseases. Good news only now, please. We don't too much of that. Whereas others were saying, no, we're now actually more interested in what's going to be the next pandemic, or we're now more interested in vaccines for different diseases, not just COVID. So I think there's a bit of a settling in now into, but part of me thinks, was this always what it was like before COVID, and I've just forgotten because it's been so long. So a lot of health stories are still massively of interest to the media, I would say. But David, do you?
Yeah, I think we're in a funny situation, because I think we've gone from the likes of having 2 years where basically pretty much all newsrooms knew that any COVID story was going to perform extremely well. And as you say, like Fiona, we're now kind of going back into this sort of post-COVID landscape. And all newsrooms are very, very much kind of data and like sort of metric driven. They monitor obsessively the amounts of hits which stories get. And each of them, like, they've kind of gone back to basically saying, you know, which stories perform best with our own individual audiences, and we're going to kind of like double down and focusing like on those ones. So I think, as an example, I work, you know, for the New Scientist, writing like news stories, writing features, and they basically, you know, monitor like very, very closely how well each of them perform, and they kind of have their list of their bankers, and they tend to be things like insomnia, like nutrition, pieces like that, you know, which they know are very always going to be kind of perform consistently well in terms of hits. You know, again, like so the Guardian, like it's very kind of very much the same. You know, Telegraph, like stories of their particular audience, you know, Alzheimer's, dementia stories, heart disease, statins, all those kind of topics. So that's kind of like what's happening. I think in terms of COVID, that sort of faded like out of the memory of like the newsrooms like a little bit. I mean, I think all journalists are kind of aware that like long COVID and perhaps the long-term effects of COVID are going to be things which are going to be very important to cover in the next few years. I think global health stories are still going to be very much like in the minds of journalists. You know, we've seen the attention this year that monkeypox and, you know, Ebola and other like some kind of infectious disease outbreaks have had. And I think a lot of journalists are going to have in their minds, you know, what is going to be like the next pandemic. And so I mean, you're going to continue seeing like global health being of interest in the next few years. But yeah, I think it's going to be a little bit of a like return to 2018, 2019. That's it for now.
Excellent. Well, thank you. I think that's a great way to finish up then. I want to thank you all for taking the time to join this conversation with me, and for all of the people who managed to join and ask some questions. Hope you find this really useful, and we really enjoy when we can come together to have these conversations, and hopefully we can do it again in person soon. So, thank you, everyone.
Thank you very much.
Thanks very much. Nice to see you.